Hello and welcome. Today we're going to talk about something that can really worry a lot of parents, glue ear. You've probably heard of it, it's super common in kids, but it can also be pretty confusing. So the whole point of this explainer is to cut through that confusion and give you some clear, straightforward answers. You know that moment, right? You call your child's name, maybe once, maybe twice, and you get nothing. So you start to wonder, are they just ignoring me, or is something else going on? That little question is often the first clue. And it's the perfect place for us to start. All right, here's the game plan. We're going to start with the basics. What exactly is glue ear? Then we'll get into why it happens. After that, we'll cover what to look for, the different ways it's treated, and finally, what recovery looks like. Let's get into it.
So, first things first, let's pull back the curtain on this whole glue ear thing and get a really solid idea of what we're dealing with. Honestly, the name says it all. You've got this tiny space behind the eardrum, the middle ear, and it's supposed to be full of air. But with glue ear, that space gets filled up with this thick, sticky liquid that's, well, a lot like glue. It's really that simple. Okay, so that leads to the obvious next question. Where does this fluid come from? Why does it build up? Well, it all comes down to a really small but super important bit of plumbing inside the ear.
Here's the lowdown. There's this little tube called the eustachian tube, and it runs from your middle ear to the back of your nose. Think of it like a pressure valve. If that tube gets blocked, which can happen easily after a cold, air can't get into the middle ear, so a vacuum forms. That suction then pulls fluid out from the nearby tissues right into that middle ear space, and bam, you got your glue.
I love this analogy because it's just perfect. The fluid stops the eardrum from vibrating properly. It's not like the sound is completely gone, it's just muffled. So for your child, it's like someone has literally turned the volume down on the entire world. It's a really powerful way to imagine what they're going through.
So how do you know if this is happening? Little kids aren't great at saying, hey, my hearing feels a bit muffled. So it's really up to us as parents to play detective and look for the signs. And before you start to worry, just look at this number. 7 out of every 10 kids will get glue ear at least once before they're 4 years old. I mean, that's huge. So if your child has it, you are in very, very good company. This is a totally normal part of growing up.
Now, certain things can make it a little more likely. If your child gets a lot of colds or ear infections, that's a big one. Being around smoke is another risk factor. There's also some connection to being bottle-fed, and if it runs in the family, that can play a role too.
Okay, so what are the actual red flags? Well, the most obvious one is hearing loss. They're cranking up the volume on the TV, or they just don't seem to hear you. You might also see them pulling at their ears. And this is a big one, because they're not hearing things clearly. It can sometimes cause delays in their speech, or even make them act out because they're just plain frustrated.
All right, so you think your child might have glue ear. Now what? The good news is that there's a well-established game plan for this, and it ranges from just keeping an eye on it to a really simple procedure.
Doctors usually take it step by step. The very first move is often just to wait and see, because a lot of the time, this problem fixes itself. If it hangs around, there's a cool non-surgical balloon treatment, and then, for the really stubborn cases, a minor surgery is an incredibly effective fix.
So let's break down those first two options. Wait and see is just what it sounds like. A doctor monitors the situation for a while. The balloon treatment, though, is pretty clever. The child actually blows up a special balloon using their nose. The pressure from doing that can be just enough to pop open that block tube and let everything drain out.
Now, if those don't do the trick, the next step is grommet surgery. And I know, surgery can sound like a scary word, but this is a really minor procedure. A surgeon makes a tiny little cut in the eardrum, suctions out all that sticky fluid, and then pops in a microscopic tube called a grommet. That little tube just keeps the ear ventilated, and the best part, it falls out all on its own after about 6 to 12 months. And that brings us to the final and I think most reassuring part of this whole thing. What's the long-term outlook? What can you expect down the road?
Check this out. This is fantastic. For about half of all kids with glue ear, it just goes away on its own within 3 months. No intervention needed. Their hearing goes right back to normal. Time is often the best healer here. For the other half, it might take a little longer or need a little help from one of the treatments we talked about.
And here it is, the most important thing to remember for your own peace of mind. Kids literally grow out of this. As they get bigger, that eustachian tube gets wider and works better. That's why glue ear is almost unheard of in kids over the age of 8. It's a temporary problem.
So let's just do a super quick recap. Glue ear, it's just sticky fluid where air should be.
It's incredibly common in young kids. It causes temporary, muffled hearing. Most of the time, it's not serious and it clears up by itself. And for the cases that stick around, the treatments work really, really well.
So we'll leave you with this thought. Now that you know what to look for and you understand the options, you are in the driver's seat. You're your child's #1 advocate. You can watch for the signs, have confident talks with your doctor, and make sure their hearing health is always looked after.